Just how important is a budget that considers minority groups and people living with disability in society? These are questions that deserve an in-depth analysis, highlighting the complex nature of society and considerations that must be made. In the following report, we give you a glimpse of it.
According to the World Health Organization, the financial burden of visual impairment is enormous globally, with an estimated cost of $411 billion annually. Away from the costs, individuals with vision impairment are more likely to experience restrictions in many ways. These include lack of independence, mobility, and the educational achievement, with increased risks of injuries, poor mental health, and social isolation. Jeremiah Gwafa, an ophthalmic nurse, said to ease the burden of visual loss on the country, the government of Zimbabwe, with support from its partners, has been making huge strides. He spoke to ZN Prime on the sidelines of a recent eye clinic held at the Victoria Falls Hospital.
In line with the Vision 2030 that has been promulgated by our president, that one of leaving no place and no one behind. We are happy, we are focusing on reaching 2030 with all our people having been managed properly, especially in their health care. What a day that we wait for, to see the accomplishment of this great vision from such a great visionary. God bless Zimbabwe.
Sight Savers Zimbabwe's country director Peter Bare said they have been working in Zimbabwe for the past years to restore eye patients' vision and dignity.
That we've been doing in Zimbabwe for a long time include Midlands, Matabeleland North province, and as well as Matabeleland South province. So Sight Savers, in one of the eye camps that is done, we were able to operate more than 200 patients in one of the eye camps. And by the way, we've done more than 2 eye camps in that particular district. But our biggest number so far that we did in Africa was operating to more than 200 patients. And the high turnover was because that the last eye camp to be done in Binga was around 2014.
Waiting for a tent to be operated on, 72-year-old Hilda Ncube of Nkosana, Victoria Falls, was hopeful her vision will be restored. The cataract in her eye needed attention. Though cataracts are mainly prevalent in the elderly, 19-year-old Nathaniel Ncube has had a cataract in his right eye since the age of 4 after suffering an injury. He was hopeful that the quality of his life would improve significantly after the surgery. For Victoria Falls, Sight Savers had a target of operating 20 people in a day, with these programs also set for provincial implementation.
As Sight Savers, we are supporting the Ministry of Health and Child Care in eye care through a system strengthening approach, where we are facilitating trainings for health workers. We're focusing on primary eye care and refractions, as well as gender and disability inclusion, to make sure that no one is left behind in terms of eye care.
For a 50-year-old man of cloth, this was a miracle. He broke into tongues after his bandages were removed on the post-operation day 1. For him, the surgery was God's work.
Me, I'm a man of God. I had a problem, so I went to the doctors, and my eyes, I'm seeing properly. I think, yes, I also prayed. I said God to give me encouragement so that to remove fear from me. So I think it's a well done job.
70-year-old Betty Ndimande was also grateful for a restored sight. The surgeries, which occurred on August 21, coincided with the 11th Congress of the College of Ophthalmology of Eastern Central Southern Africa, COESCA, a joint conference hosted by the Ophthalmological Society of Zimbabwe and the Zimbabwe Optometry Association. For ZTN Prime, I'm Cecilia Kamputa in Victoria Falls.
Konapo, ipapo pa ZTN Prime, DSTV channel 294, the place to be.